All right, after your laser, let's talk about instructions. So let's first talk about what to expect after. So this is pertinent for Fountain of Youth treatments, Bright and Tight, RF microneedling, fractional CO2, and erbium laser resurfacing. So what to expect? Mainly, you are going to have roughly a week's worth of downtime. So typically red for the first couple days, but let's say about 3 days. Then you'll get bronzy about day 4. So that's when you're super, super tight, your skin's darker than normal. You're like, hey, what's going on? Then you will peel after that. That dark skin will kind of start to come off. Depending on the level that I go to, depends on the downtime. So I can make all of these treatments very, very light, not much downtime at all, or I can get very, very aggressive. The lighter you are on your settings, the less downtime you have, but the less dramatic the result is. So you always want to take that into consideration. If you have a history of fever blisters, I need to know. I need to write you a prescription for Valtrex. So please tell me. Typically, I like to start this before, continue it through your treatment, and continue it after as well. Not forever, just for a little bit. If you are getting a series of these treatments, like once a month times 3, then every time I do it, you will be on the medication. That is to suppress those fever blisters. Those are triggered by heat, stress, and light, and that's what laser is. So let's also talk about aftercare instructions. So what to do after. You will go home with a sample of Vanicream. So this is a cleanser, an ointment, and a moisturizer. Why Vanicream? Vanicream is very boring. Nothing at all is in it. So there's not much for your skin to respond to. The reason why I choose Vanicream is because I need something mild and boring on the skin. If I just made it mad with all this aggressive laser stuff and you go throw on an active product to repair the skin, guess what? It's going to piss it off. It's too much. So I have to stick with mild and boring. I don't recommend Aquaphor anymore because it has lanolin in it, and that can actually make it worse. So some people, they're allergic to it, so I don't do it. So the main pointers, I'm going to go into more detail, but if you don't listen to anything, listen to this. Wash your face morning and night. I took off the protective layer of skin, which is the outermost layer of skin. That job is to protect you from infection and protect you from the sun. So guess what? You're at risk for infection. You're at risk for a sunburn. So protect yourself. Don't go bake outside in the sun 5 minutes after doing this. That's not smart. I want you to keep it hydrated too. So you're going to wash your face morning and night with that Vanicream cleanser. You can also use Zeo's Gentle Cleanser. That's safe as well, morning and night. So I want you to put some on your fingertips. Rub in cool water, not hot, not even room temperature, cool. You're gonna want something to kind of soothe that skin. If you're doing this in the shower, don't put that beaming hot water on your face. It needs to be done at the sink separately. So wash your hair, wash your body, and then go to the sink after and wash it with cool water, okay? Fingertips, and then you're gonna pat dry. You're not gonna use the dirty towel to wash your face because guess what? That's full of bacteria. Even though you're bleaching your towels, I promise it still has bacteria on it. So you can even get some paper towels, even on the side, and just damp it after to dry up all the water. So you're gonna wash your face morning and night until you're healed. Then I want you to keep it moist, right? So how are you gonna do that? I want you to splash water on, and then the first few days after, you're gonna be extra irritated. So you're gonna wanna use that ointment, the Vanicream ointment. That is going to lock in the moisture. I don't want your skin to scab, especially if I'm doing it an aggressive setting. If I'm doing light settings, this won't even be an issue for you. But if I'm doing more aggressive settings, you can scab. So I don't want you to scab. I wanna keep it nice and wet, and then lock it in with the ointment. So a lot of people, they say, well, Candace, my skin was so dry. I'm like, how did you put it on? They put it on straight a dry face. No, give it hydration, give it water. Splash some water on, then lock it in with that ointment. Then you also are gonna go home with the Vanicream moisturizer. So that is whenever the first few days you'll be using the ointment. Some people, they're like, Candace, that's too heavy, that's too thick, I don't need all that. Then at that point, you switch to the lighter moisturizer. I have some people that's, especially my older ladies, they like the heavy ointment. They do the heavy ointment the whole time. Me, I'm acne prone. I'm like, don't put that ointment by me. No, I stick with the lighter moisturizer. So everybody's a little bit different, but typically ointment for a few days, then transition to the moisturizer. You want to keep that skin hydrated. That's gonna help it heal quicker. Also, I want you drinking a ton of water. The more water you drink, the quicker you're gonna recover, okay? So I'm keeping it wet and I'm keeping it clean. I don't want an infection. Next is starting the next day after your laser, you're gonna do 2 capfuls of white distilled kitchen vinegar, regular vinegar, nothing fancy about it, with 1 cup of water. So 2 capfuls of vinegar with 1 cup of water. What are you gonna do with it? You're gonna mix it together and you can put it in a squirt bottle and you can spritz your face with it. Why? What is that going to do? That's going to help take out the sting, and it's also going to help kill bacteria, because I just told you I removed that outermost layer of skin, right? So you're at risk for an infection. So I need to kill anything that's wanting to start to grow on your face. So guess what? That vinegar is going to help. So you're going to do that as much as needed. There's no max to this. As much as needed for the next few days after the laser until your skin's healed. Everybody's like, well, when to stop? You know. It doesn't make sense now, but you know whenever you're in it. So after you spritz that on, just put some more ointment on or more moisturizer on to help lock in that moisture, okay? I also want, the second you leave, I want you to Clorox wipe your phone. I want to disinfect all that bacteria on your phone. The first thing I see patients do is they grab their cell phone and they shove it against their face. I'm like, that is full of bacteria. So you should be talking on speakerphone, or if you insist on talking it on the thing, then Clorox wipe it, something, disinfect it. Also, we always touch our face. We don't even realize we're touching our face. Wash your hands with soap and water. Antibacterial soap. Dial, D-I-A-L, is antibacterial. Wash your hands with it. Also, no makeup until that skin's healed. So everybody's like, when is that going to be? Typically about a week, but everybody's a little bit different. Might be a speck sooner, might be a speck less, but roughly about a week. I also want you to go home and change your pillowcase. Pillowcases are full of bacteria. So if you like, well, I only have 1 pillowcase, that's a whole nother issue for another day, but throw a fresh towel on top of it. And I want you changing your pillowcase every day throughout that week whenever you're recovering. If you don't have that many pillowcases, then put a new towel. We all have towels. Put that down on top of your pillowcase. Okay, so I'm keeping it washed, I'm keeping it moisturized, and I'm doing the vinegar and water. I'm changing out my pillowcase. I'm drinking lots of water. Also, another thing, sometimes the more aggressive I get, especially if I do the eyelids or directly under the eyes, patients can swell. So if you're an easy sweller, we typically, as females, a lot of us know this, if we swell easily. If you're nervous about it, you can take a Zyrtec or a Claritin, starting like a week before your laser, throughout your laser treatment, and continue it until all the swelling's gone. After the treatment, you can even add on Benadryl at night. So you take Claritin or Zyrtec during the day and Benadryl at night. That's gonna help blunt those little histamine cells that helps with all the swelling. I don't want direct ice on your skin. You're gonna actually cause more damage. You can burn your skin because your sensation's off post this laser. So everybody's natural response is, oh, let me go shove ice on it. No, do not shove ice on it. You can sit in front of a fan, but no direct ice on it, okay? So lots of water. When can you start the rest of your ZO products? Start once your skin's healed. If that's a week, then start in a week. And if you go to do it and you go to do things like get the scrub and your pads and you're like, oh my God, this burns, wait a couple more days. It's no big deal. I want you to try to start as soon as possible. I don't want you to wait 3 weeks and then be like, oh, let me start now. No, as soon as that skin is healed, that's whenever I want you to restart. It'll also help with the remaining little tidbits of dead skin cells and things that's still coming off. That's what ZO is designed to do. It's designed to take off those dead skin cells. So it's going to actually expedite your recovery. If you have any questions at all, don't hesitate to come. Give us a call, shoot us a text, something like that. We're here to help. If you are doing a series of these, we're going to do it once a month times 3. That's going to give you the best possible results. When do you see results after this? Yes, you look good once you heal in about a week, but you look even better a month later, even better 3 months later, and guess what? Even better 6 months later. So you look better in time because all those little skin cells, we just put them in boot camp and stimulated them and say, hey, let's revive, let's start working again. So it doesn't happen overnight. It takes time to build collagen, build elastin, do all those things. So it's gonna look even better. So we want you back in the office 1 month after your last treatment, 3 months after your last treatment, 6 months after your last treatment. Even though you're doing nothing else, I want to see you in the office. I want pictures and I want to see what your skin did. So that's about it, guys. If you have any other questions, let us know. This is what to expect after your laser.